Picture this. It's 6:30 in the morning. You wake up, stretch your tired body, and stumble to the kitchen. Your stomach growls. The doctor told you to eat more fruit, so you reach for that beautiful orange sitting on your counter. You peel it, take that first juicy bite, and you think you're being healthy. But here's what nobody warned you about. That innocent piece of fruit you just ate on your empty stomach could be setting off a chain reaction inside your body right now, irritating your stomach lining, worsening your hemorrhoids, and potentially creating problems that might haunt you for years. I know what you're thinking. It's just fruit. How bad could it be? My friend, I asked that same question 3 years ago, before I spent weeks researching this very topic after my own father ended up in the emergency room. What started as healthy eating habits turned into severe gastric distress, and the culprit? A fruit he'd been eating on an empty stomach for decades. What I discovered shocked me, and today I'm going to share everything with you. In the next several minutes, you're going to learn about 7 specific fruits that millions of people eat on empty stomachs every single day. Fruits that can silently damage your digestive system, aggravate hemorrhoids, and create painful complications you never saw coming. But here's the thing, this isn't about scaring you away from fruit forever. By the end of this video, you'll know exactly which fruits to avoid on an empty stomach, why they cause problems, and most importantly, the right way to enjoy these nutritious foods without the painful consequences. So if you've ever suffered from hemorrhoids, acid reflux, stomach pain, or digestive discomfort, or if you simply want to protect yourself and your loved ones from these preventable problems, then stay with me until the very end, because the fruit that's causing you pain right now might be the last one on this list. Let's begin. Before we dive into our list of 7 fruits to avoid on an empty stomach, let me explain why this matters so much, especially for those dealing with hemorrhoids and stomach issues. You see, when your stomach is empty, typically first thing in the morning or after fasting for several hours, your digestive environment is in a unique state. Your stomach pH is highly acidic, hovering around 1.5 to 3.5 on the pH scale. There's no food in there to buffer that acid. Your stomach lining, while remarkably resilient, is essentially exposed and vulnerable. Now, hemorrhoids, those swollen blood vessels in your rectum and anus, affect nearly 50% of adults over the age of 50. They're caused by increased pressure on these veins, often from straining during bowel movements, chronic constipation, or prolonged sitting. What you eat directly impacts the severity of your symptoms. Here's the connection that most people miss. The foods you consume on an empty stomach can directly influence your stomach acid levels and irritation, how quickly food moves through your digestive system, the consistency of your stool, inflammation throughout your entire GI tract, and whether you experience painful bowel movements. According to research published in the World Journal of Gastroenterology, dietary choices play a crucial role in both triggering and alleviating hemorrhoid symptoms. Meanwhile, gastroenterologists at the Mayo Clinic emphasize that acidic foods consumed on an empty stomach can significantly worsen conditions like gastritis, acid reflux, and peptic ulcers. The fruits I'm about to share with you aren't necessarily bad fruits. In fact, many of them are nutritional powerhouses that should be part of a healthy diet. The problem is when you eat them, and today you're going to learn why timing matters so much. So let's get into it. Starting with number 7. Coming in at number 7 on our list are citrus fruits, and this includes oranges, lemons, limes, grapefruits, and tangerines. Now I know what you're thinking. Wait a minute, aren't oranges supposed to be one of the healthiest foods on the planet? You're absolutely right. Citrus fruits are packed with vitamin C, antioxidants, flavonoids, and other compounds that support your immune system, protect your heart, and even help fight certain cancers. A single medium orange provides over 100% of your daily vitamin C requirement. But here's the problem. Citrus fruits are highly acidic. The pH of an orange typically ranges from 3.0 to 4.2. Lemons are even more acidic, with a pH around 2.0 to 2.6. When you consume these fruits on an empty stomach, when there's no food to buffer that acidity, you're essentially pouring acid directly onto your sensitive stomach lining. Let me share what the research tells us. A study published in the journal Gastroenterology Research and Practice found that citric acid is among the most effective triggers of acid reflux and gastritis. Approximately 40% of patients with sensitive stomachs reported significant discomfort, including heartburn, bloating, and stomach pain, when they consumed citrus fruits on an empty stomach. Dr. Lawrence Friedman, chair of the Department of Medicine at Harvard-affiliated Newton Wellesley Hospital, explains that acidic foods like citrus can worsen symptoms of gastroesophageal reflux disease, or GERD. The acids can irritate the esophageal lining, causing that familiar burning sensation. But what about hemorrhoids? Here's the connection. When citrus fruits cause digestive distress, many people experience changes in their bowel habits. For some, the irritation can lead to diarrhea, which means frequent acidic bowel movements that irritate hemorrhoidal tissue. For others, the discomfort leads them to avoid eating properly, contributing to constipation and straining. Additionally, some research suggests that highly acidic foods can increase inflammation throughout the digestive tract. This inflammation doesn't stay isolated, it can exacerbate the swelling and irritation of existing hemorrhoids. So, what should you do if you love citrus fruits? First, never eat them first thing in the morning on a completely empty stomach. Second, always pair citrus with other foods, especially those containing protein or healthy fats, that can buffer the acidity. Having orange slices with your oatmeal and eggs is vastly different from drinking a large glass of orange juice alone. Third, consider eating citrus fruits as a mid-morning snack after you've already had breakfast or as part of a balanced lunch or dinner. Fourth, if you have existing stomach conditions like gastritis or GERD, you may need to significantly limit citrus consumption altogether, but consult with your doctor first. Remember, the vitamin C and other nutrients in citrus fruits are valuable. The goal isn't to eliminate them entirely, it's to consume them strategically when your stomach has protection. Now, let's move to fruit number 6. At number 6, we have tomatoes. But wait, you might be saying, tomatoes are a vegetable, right? Actually, no. Botanically speaking, tomatoes are classified as fruits. They develop from the flower of the tomato plant and contain seeds. And like our citrus friends, tomatoes present significant challenges when consumed on an empty stomach. Tomatoes contain two primary organic acids, citric acid and malic acid. These compounds give tomatoes their characteristic tangy flavor, but they also make tomatoes problematic for anyone with digestive sensitivities. Here's what happens when you eat tomatoes on an empty stomach. First, the acids can stimulate excess gastric acid production. A 2024 study published in Biology Insights found that tomatoes are frequently reported as triggers for GERD symptoms because their acidity can increase acid levels in the stomach, leading to heartburn, regurgitation, and discomfort. Second, certain compounds in tomatoes may cause the lower esophageal sphincter, that critical valve between your stomach and esophagus, to relax inappropriately. When this happens, stomach acid can flow backward into your esophagus, causing that painful burning sensation we call heartburn. Third, tomatoes can delay gastric emptying for some individuals. When food stays in your stomach longer than it should, acid exposure increases, and digestive discomfort worsens. For hemorrhoid sufferers, tomatoes present additional concerns. The Health Grades Medical Advisory Team notes that acidic foods like tomatoes can intensify digestive irritation that ultimately affects bowel function. Changes in bowel habits, whether toward constipation or diarrhea, directly impact hemorrhoid symptoms. Now, let me be clear, raw, fresh tomatoes are generally easier on the stomach than processed tomato products. That's because cooking and processing actually concentrates the acids. Tomato paste, marinara sauce, ketchup, and tomato juice often have higher acidity per serving than a fresh tomato. The worst offenders include tomato sauce with a pH of 4.1 to 4.5, ketchup with a pH of 3.8 to 4.2, and tomato juice, which is highly acidic and easy to overconsume. If you must have tomatoes, here are some safer approaches. Add a pinch of baking soda when cooking tomato-based sauces. This neutralizes some of the acidity. Always eat tomatoes as part of a complete meal, never alone on an empty stomach. Pair tomatoes with alkaline foods like leafy greens, cucumbers, or avocados. Remove the skin and seeds when possible, as these contain higher acid concentrations. Choose ripe, fresh tomatoes over processed products whenever you can. If you're currently suffering from hemorrhoids, acid reflux, or gastritis, consider tracking your symptoms after eating tomatoes. You might discover they're a bigger trigger than you realized. Let's continue to fruit number 5. Number 5 on our list might surprise you: unripe bananas, those green or slightly yellowish bananas that haven't fully ripened yet. Now, this is where timing and ripeness become critical to understand. Ripe bananas, the ones with yellow peels and maybe a few brown spots, are actually quite gentle on the digestive system. They contain soluble fiber that helps soften stool and promote regular bowel movements. For most people with hemorrhoids, ripe bananas can be beneficial. But unripe bananas? That's a completely different story. Here's the science. Unripe bananas are extremely high in resistant starch, a type of carbohydrate that your small intestine cannot easily break down. While resistant starch can be beneficial for gut bacteria in moderate amounts, large quantities consumed on an empty stomach can cause significant digestive problems. A 2019 review, published in Nutrients, found that green bananas contain high levels of resistant starch and tannins, compounds that can slow gut motility and firm up stool. For people prone to constipation, this is a recipe for disaster. According to research from Medical News Today, green bananas also contain higher concentrations of tannins, astringent compounds that can slow down intestinal contractions, bind to proteins and make them harder to digest, contribute to constipation, and cause gas and bloating. When you eat an unripe banana on an empty stomach, you're essentially consuming a large dose of resistant starch with nothing to buffer its effects. Many people report feeling uncomfortably full, bloated, or constipated afterward. For hemorrhoid sufferers, this is particularly problematic. Constipation leads to straining during bowel movements, and straining is the primary cause of hemorrhoid flare-ups. The increased pressure on rectal veins causes them to swell, becoming painful, itchy, and prone to bleeding. Additionally, unripe bananas are very high in potassium and magnesium. Baptist Health reports that consuming potassium-rich foods without other nutrients to balance absorption can disrupt electrolyte levels, potentially causing energy slumps and other issues. Here's what you should do instead. First, wait for your bananas to fully ripen before eating them. Look for a bright yellow peel with some brown speckling. That's when the resistant starch has converted to easily digestible sugars. Second, if you prefer less sweet bananas, at least ensure they're uniformly yellow before consuming. Third, never eat any banana, ripe or unripe, as the very first thing you put in your mouth in the morning. The combination of natural sugars and potassium can spike blood sugar and disrupt electrolyte balance. Fourth, pair bananas with protein sources like Greek yogurt, peanut butter, or eggs to slow digestion and prevent blood sugar spikes. Fifth, if you're currently constipated or experiencing a hemorrhoid flare-up, avoid unripe bananas entirely until your symptoms improve. The difference between a ripe and unripe banana on your digestive system is dramatic. Choose wisely. Now, let's look at fruit number 4. At number 4, we have a fruit that people often snack on mindlessly by the handful: grapes. Grapes are small, sweet, and incredibly easy to overconsume. You start with just a few, and before you know it, half the bag is gone. This is precisely why grapes can be problematic on an empty stomach, especially for people managing hemorrhoids or digestive issues. Let me explain the primary concerns. First, the sugar content. A single cup of grapes contains approximately 15 to 23 grams of carbohydrates and around 15 to 20 grams of natural sugar. When you eat grapes on an empty stomach with nothing to slow absorption, these sugars rush into your bloodstream rapidly, causing a spike in blood glucose. According to research published by Diabetes Meal Plans, grapes have a moderate glycemic index and relatively low fiber content, only about 1 gram per cup. This means there's very little to slow down the sugar absorption. For people watching their blood sugar, this can lead to energy crashes, increased hunger, and even insulin resistance over time. Second, the digestive impact. While not highly acidic like citrus fruits, grapes can still cause digestive disturbances when consumed in large quantities on an empty stomach. The fructose in grapes may ferment in the gut, producing gas and causing bloating, especially in people with fructose malabsorption, a condition affecting approximately 30 to 40% of the global population according to the American Journal of Clinical Nutrition. Third, the hemorrhoid connection. Experts at Everyday Health note that grapes are easier to eat in large quantities than most fruits. You don't even realize how many you've consumed until it's too late. This overconsumption can lead to rapid blood sugar fluctuations that affect energy and appetite, digestive upset from excess fructose, changes in bowel habits, and increased intestinal gas and pressure. For hemorrhoid sufferers, any food that causes gas, bloating, or irregular bowel movements can worsen symptoms. The pressure from trapped gas can aggravate swollen hemorrhoidal tissue, while irregular bowel habits lead to either straining from constipation or frequent irritating bowel movements from loose stools. How should you enjoy grapes safely? Pre-portion your grapes. Measure out a serving of about 15 to 17 grapes, roughly half a cup, instead of eating straight from the bag. Always eat grapes as part of a meal or snack that includes protein or healthy fat. Pair them with cheese, Greek yogurt, or a handful of nuts. Never eat grapes first thing in the morning before anything else. Have them with or after breakfast. If you're diabetic, pre-diabetic, or insulin resistant, monitor your blood sugar response to grapes carefully and consult your doctor about appropriate portions. Choose whole grapes over grape juice or raisins. Grape juice is even more concentrated in sugar, and raisins contain the sugar of multiple grapes in dehydrated form, making overconsumption even easier. Now, let's talk about fruit number 3. Number 3 on our list is a fruit that many people have never heard of, but if you've eaten it, you likely haven't forgotten it. Persimmons. Persimmons are beautiful, orange-hued fruits that are popular in Asian cuisines and increasingly available in Western supermarkets, especially during autumn and winter months. They have a sweet, honey-like flavor when ripe, but they harbor a dangerous secret when consumed improperly. Persimmons contain extremely high levels of tannins, the same astringent compounds found in tea, wine, and unripe fruits. In persimmons, particularly unripe ones, the tannin content is exceptionally high. Here's where things get serious. When you eat persimmons on an empty stomach, especially if they're not fully ripe, the tannins can interact with your stomach acid and proteins in your stomach to form a hard, compacted mass called a bezoar, specifically a phytobezoar or diospyrobezoar. This is not theoretical. This is a documented medical emergency. A 2026 case study published in Frontiers in Medicine documented an 88-year-old woman who required emergency endoscopic treatment for gastric outlet obstruction caused by a persimmon bezoar. The bezoar, measuring an incredible 6.0 centimeters by 4.0 centimeters, had completely blocked her duodenal bulb, causing severe vomiting, abdominal pain, and electrolyte imbalances. Research published in the Singapore Medical Journal described a 39-year-old woman who developed simultaneous small bowel and stomach obstruction after eating just 4 persimmons. Surgeons had to remove a 15-centimeter bezoar from her stomach and a 5-centimeter bezoar from her small bowel. According to gastroenterology research and practice, 15 to 20% of all bezoar cases are directly linked to persimmon consumption on an empty stomach. Why does this happen? The high fiber content, combined with shibboleth, a specific tannin in persimmons, polymerizes in gastric acid to form these solid masses. The process is accelerated when the stomach is empty, when the persimmon is unripe, when large quantities are consumed, and when the person has reduced gastric motility, which is common in elderly individuals. For hemorrhoid sufferers, bezoars represent an extreme but illustrative example of what can happen when inappropriate foods meet vulnerable digestive systems. Even if you don't develop a full bezoar, the constipating effect of persimmon tannins can significantly worsen hemorrhoid symptoms. How to safely enjoy persimmons. Only eat persimmons when they are completely ripe. Ripe persimmons have soft, almost jelly-like flesh and very sweet flavor. If there's any firmness or astringency, they're not ready. Never eat persimmons on an empty stomach. Always consume them after a meal. Limit your intake to 1 small persimmon at a time and don't eat them daily. If you have a history of digestive issues, gastric surgery, diabetes, or slow gut motility, consider avoiding persimmons entirely or consult your doctor first. Elderly individuals should be particularly cautious, as reduced stomach acid and slower gastric motility increase bezoar risk. This is one fruit where caution is truly warranted. Don't let its beautiful appearance fool you. Let's move to fruit number 2. At number 2, we have raw or unripe papaya, and this is a fruit that requires careful distinction from its ripe counterpart. Ripe papaya is actually one of the most digestive-friendly fruits on the planet. It's loaded with an enzyme called papain, which helps break down proteins and supports healthy digestion. Ripe papaya has been used traditionally to treat digestive disorders, reduce inflammation, and even promote wound healing. But raw or unripe papaya? That's a completely different situation. The concentration of papain and other enzymes in raw papaya is significantly higher than in ripe fruit, and this creates problems when consumed on an empty stomach. According to Medicine Net, while papain can be beneficial for digestion in appropriate amounts, excessive papain intake can cause gastritis, which is inflammation of the stomach lining, throat irritation, stomach discomfort and cramping, and nausea. When you eat raw papaya on an empty stomach, the concentrated enzymes encounter an environment with nothing to digest except your own stomach lining. The papain begins breaking down proteins, and your stomach's protective mucus layer contains proteins. Research from the International Journal of Pharmaceutical Sciences found that unripe papaya contains higher quantities of potentially irritating compounds compared to ripe papaya. While these compounds have therapeutic applications in controlled settings, consuming them on an empty stomach can backfire. For hemorrhoid sufferers, raw papaya presents additional concerns. First, the high fiber content can be difficult to process on an empty stomach, leading to bloating, gas, and abdominal cramping. Second, digestive upset from raw papaya can alter bowel habits, potentially leading to either constipation or diarrhea, both of which worsen hemorrhoids. Third, the latex in raw papaya can cause allergic reactions in some individuals, particularly those with latex sensitivity. This can manifest as digestive distress, skin reactions, or worse. There's also a critical warning for pregnant women. Raw papaya contains latex and high concentrations of papain that may stimulate uterine contractions. Multiple sources warn that pregnant women should completely avoid unripe papaya due to potential risks of miscarriage or premature labor. How to safely consume papaya? Always ensure your papaya is fully ripe before eating. Ripe papaya has orange-yellow flesh, sweet flavor, and soft texture. Never eat papaya, ripe or unripe, as the very first thing in the morning. Eat it with or after other foods. If you have a sensitive stomach, start with small amounts and observe how your body responds. Avoid raw papaya entirely if you're pregnant, have latex allergies, or take blood-thinning medications. When in doubt, cook your papaya. Heat denatures the papain enzyme and makes the fruit much gentler on your digestive system. Ripe papaya can be a wonderful digestive aid, but timing and ripeness are everything. Now, the moment you've been waiting for. Fruit number 1. And finally, at number 1, the fruit that might shock you the most, watermelon, along with other high watermelons like honeydew and cantaloupe. Watermelon? Really? But it's mostly water. How can water be bad for you? Here's the truth that most people don't realize. Watermelon is approximately 92% water and contains significant amounts of fructose, the natural fruit sugar that can cause digestive problems for many people. When you eat watermelon on an empty stomach, you're essentially flooding your digestive system with water, sugar, and very little else. Let me explain why this is problematic. First, the blood sugar impact. Despite being mostly water, watermelon has a relatively high glycemic index, around 72 to 80 depending on the variety. When eaten on an empty stomach with nothing to buffer absorption, this sugar hits your bloodstream rapidly, causing blood glucose spikes followed by crashes. Research from Kim's Sunshine Hospital emphasizes that high watermelons consumed on an empty stomach can cause rapid glucose level spikes, leaving you feeling irritable, hungry, and fatigued soon afterward, the classic sugar crash. Second, the digestive disruption. A study published in the American Journal of Clinical Nutrition found that individuals with fructose malabsorption, which affects 30 to 40% of people globally, experience significant bloating, gas, and gastrointestinal distress after consuming high fructose fruits like watermelon. When you eat watermelon on an empty stomach, the fructose can ferment in your gut before proper digestion occurs, producing gas, cramping, and bloating. For some people, this leads to urgent, loose bowel movements. Third, the dilution effect. All that water in watermelon can actually dilute your stomach acid, which sounds good but isn't. Your stomach acid is there for a reason. It kills harmful bacteria, activates digestive enzymes, and begins the breakdown of food. Diluting it with large amounts of water-heavy fruit can impair these functions. Fourth, the hemorrhoid connection. For hemorrhoid sufferers, watermelon's impact is twofold. The bloating and gas create internal pressure that aggravates swollen hemorrhoidal tissue. The potential for loose, frequent bowel movements irritates the sensitive anal area, and the sugar fluctuations can affect energy and appetite, disrupting normal eating patterns. Additionally, eating large amounts of watermelon can create urgency, that sudden need to have a bowel movement. Rushing to the bathroom and not having complete, comfortable bowel movements is a recipe for hemorrhoid problems. How to safely enjoy watermelon. Never eat watermelon first thing in the morning on an empty stomach. Keep portions moderate. Stick to 1 cup or less at a time. Eat watermelon with or after a meal that includes protein and fiber. Stay within 30 minutes of eating watermelon from lying down, as this can worsen any acid reflux or digestive discomfort. If you have a history of fructose malabsorption, IBS, or frequent bloating, consider limiting watermelon significantly or avoiding it altogether. For hemorrhoid sufferers, if watermelon causes loose stools or urgency, it may be making your condition worse without you realizing it. The irony is that watermelon is often considered the lightest fruit option, but its impact on an empty stomach can be anything but light. So there you have it, the 7 fruits you should never eat on an empty stomach if you care about your digestive health and hemorrhoid management. Let me quickly recap. Number 7. Citrus fruits. Oranges, lemons, and grapefruits are highly acidic and can irritate your stomach lining, worsen acid reflux, and exacerbate digestive inflammation. Number 6. Tomatoes. Their citric and malic acids can increase gastric acid production, relax your lower esophageal sphincter, and trigger heartburn. Number 5. Unripe bananas. High in resistant starch and tannins, they can cause constipation, bloating, and increased straining, a nightmare for hemorrhoid sufferers. Number 4. Grapes. Easy to overconsume, high in sugar, and low in fiber, they can spike blood sugar and cause digestive upset. Number 3. Persimmons. Their extremely high tannin content can form dangerous bezoars in your stomach, a documented medical emergency. Number 2. Raw papaya. Concentrated enzymes can irritate your stomach lining and cause digestive distress when no food is present to digest. Number 1. Watermelon. High fructose content and massive water volume can disrupt digestion, cause bloating, and trigger blood sugar crashes. Now, what should you eat on an empty stomach? Here are some better morning fruit choices. Ripe bananas with some brown spots contain soluble fiber that's gentle on your stomach and can actually help regulate bowel movements. Apples, peeled if you have a sensitive stomach, provide pectin fiber that supports digestive health, but eat them with something else, not alone. Berries like blueberries and strawberries are lower in sugar, higher in fiber, and less likely to cause digestive upset. Cooked fruits of almost any variety are gentler on your digestive system because cooking breaks down some of the compounds that cause irritation. And most importantly, pair your fruits with protein and healthy fats. An egg with some berries, Greek yogurt with sliced banana, avocado toast with a few apple slices. These combinations slow digestion, prevent blood sugar spikes, and protect your stomach lining. Before we close, I want to talk about the bigger picture, because avoiding these 7 fruits on an empty stomach is just one piece of the hemorrhoid management puzzle. If you're currently suffering from hemorrhoids, here are the dietary principles that truly matter. Fiber is your friend, but introduce it gradually. The American Society of Colon and Rectal Surgeons recommends consuming 25 to 35 grams of fiber daily for hemorrhoid prevention and management. But if you suddenly increase fiber intake, you'll experience bloating, gas, and discomfort. Increase by about 5 grams per week until you reach your target. Hydration is non-negotiable. Fiber needs water to do its job. Without adequate hydration, at least 8 to 10 glasses daily, fiber can actually make constipation worse. Think of fiber as a sponge that needs water to expand and soften your stool. Avoid these known hemorrhoid triggers: spicy foods that can irritate the digestive tract, processed foods low in fiber and high in sodium, red meat, which can slow digestion, excessive caffeine and alcohol, which cause dehydration, and fried and greasy foods that slow digestion. Practice good bathroom habits. Don't strain or push during bowel movements. Don't sit on the toilet longer than necessary. Go when you feel the urge, don't delay. And use a stool or footrest to elevate your feet while sitting. Consider targeted supplements. Psyllium husk, magnesium, and probiotics can all support regular, comfortable bowel movements. Consult your doctor about what might work for you. And remember, if your hemorrhoids are severe, bleeding frequently, or not responding to dietary changes, please see a healthcare professional. Some cases require medical intervention beyond lifestyle modifications. Here's what I want you to remember from today's video. Your digestive system is incredibly resilient, but it's not invincible. What you eat matters. When you eat matters. How you combine foods matters. The 7 fruits we discussed today aren't bad foods. They're wonderful, nutritious additions to a healthy diet when consumed properly. The problem arises when we eat them at the wrong time, in the wrong amounts, or without understanding their effects on our individual bodies. If you're dealing with hemorrhoids, acid reflux, gastritis, or any digestive condition, please don't dismiss the power of dietary timing. The simple act of eating your morning orange after your eggs instead of before could be the difference between a comfortable day and hours of regret. And if you found this video helpful, I have a favor to ask. Hit that like button so this information can reach others who need it. Subscribe to this channel and click the notification bell so you never miss our future videos on digestive health, nutrition science, and natural wellness. Leave a comment below telling me which fruit on this list surprised you the most. Have you experienced digestive problems from any of these foods? I read every single comment, and your experiences help me create better content for you. And finally, share this video with someone you love who might be struggling with hemorrhoids or stomach issues. You might just save them from years of unnecessary discomfort. Thank you for watching. Thank you for trusting me with your time and attention. Take care of your gut, and it will take care of you. Until next time.